Close your eyes for a moment. Now imagine what it would be like to lose your sight. In sports, the actions can move fast and eye injuries can happen in an instant. But being prepared to respond can help lead to better outcomes if a sports-related eye injury does occur. As an ophthalmologist, I care for injuries to eyes regularly, and I know how serious they can be. The purpose of this video is to help you recognize an eye injury and know what to do and not to do when an injury happens. The first thing to know is that following an eye injury, it is important to have an eye doctor or other medical doctor examine the eye as soon as possible. This might seem obvious, but the severity of an eye injury is not always apparent. Delaying medical attention can cause the damaged areas to worsen and could even result in permanent loss of vision or blindness. Now, there are some ways to recognize an eye injury, and some signs are more apparent than others. You need to always get medical help if you notice any of these conditions: obvious pain or trouble seeing, a cut or torn eyelid, one eye not moving as well as the other, one eye sticking out compared to the other, or an unusual pupil size or shape, blood in the clear part of the eye, or something in the eye under the eyelid that cannot be easily removed. Attempting to treat an eye injury the wrong way can cause further damage. There are 3 things you should never do with an eye injury. All these things are true for all eye injuries. Do not touch, rub, or apply pressure to the eye. Do not try to remove an object that is stuck in the eye. Do not apply ointment or medication to the eye, and see a doctor as soon as possible, preferably an ophthalmologist, a specialist in treating eye injuries. In sports, an impact or blow to the eye is a common injury, and this type of injury is treated with specific actions. Gently apply a small cold compress to reduce pain and swelling. Be careful not to apply any pressure. If a black eye, pain, or visual disturbance occurs even after a light blow, immediately contact your eye doctor or go to the emergency room. Remember, even a light blow can cause a significant eye injury. So now you know how to recognize an eye injury, and what to do and what not to do for an eye injury, and specific steps for treating a blow to the eye. Most importantly, following an eye injury, get medical attention as soon as possible. This will help avoid further damage. Your vision is too precious to risk.